So we are from Guru and we are going to talk about amphetamine. Before I dig into what is amphetamine, I'm going to talk about one of the most popular drugs, which is Adderall. Adderall mainly contains amphetamine. This drug is commonly used in students in US to enhance their academic performance to stay focused. So, these articles show that Adderall abuse is 1 of 4 students in US is using this drug. So, what is amphetamine? Amphetamine is an indirect active sympathomimetic, which is a stimulant drug. We use amphetamine mostly in ADHD. What is ADHD? ADHD is an attention deficit hyperactive disorder, which is the most common mental disorder in children. So, we use this drug to increase their focus. Next, amphetamine is used for narcolepsy. What is narcolepsy? Narcolepsy is a sleep disorder during daytime. They will feel drowsiness during the day and find it difficult to stay awake. So, we use this drug to increase their wakefulness.
Hi, my name is Muhammad Azami. I'm going to present about mode of action for amphetamine. So, amphetamine, it will bind to the monoamine transporter protein at presynaptic cleft and it will enter the neuron by this transporter protein. Next, amphetamine will disrupt this monoamine storage by inhibiting the vesicular monoamine transporter, which we call VMAT2. Next, by inhibiting the VMAT2, it will lead to increase of neurotransmitter in neuron, and it will cause monoamine transporter protein to run in reverse by increase the release of monoamine into the synaptic cleft. Then, the monoamine will bind to the receptor at the postsynaptic cleft.
Next, I'm going to talk about tolerance and dependence. So, chronic use of amphetamines leads to increased release of dopamine, resulting in continuous stimulation of the brain. Over time, this prolonged exposure depletes the neurotransmitter levels and causes the brain to downregulate the dopamine receptor as a form of compensation. This means more amphetamine is needed to achieve the same effect, a phenomenon known as a tolerance. Next, we move on to dependence. Initially, amphetamines create intense feelings of pleasure by boosting the dopamine levels. However, as the brain adapts by reducing the dopamine receptor, the natural reward response diminishes, leading to inability to feel the pleasure. To counteract this, individuals increase their amphetamine use to achieve the same pleasurable effect, resulting in a cycle of dependence. To conclude, tolerance and dependence on amphetamines develop through the brain's adaptation to continuous stimulation, requiring higher dose for the same effect and creating a compulsion to seek more of the drug.
So, there is a several withdrawal symptom that can happen when the patient who take amphetamine is stopped abruptly consume it. Firstly, dysphoria. So, what is a dysphoria? So, dysphoria is a general unease or dissatisfaction. Secondly, is a general irritability. And thirdly, is a insomnia. So, what is insomnia? So, insomnia is the sleep disorder by difficulty falling asleep, staying asleep, or waking up too early and being unable to go back to the sleep. And the last one is feeling drowsiness. Okay, that's how this withdrawal symptom can occur. So when the patient stops abruptly from taking amphetamine, the level of the dopamine, norepinephrine, and also serotonin will decrease. And as a result, the withdrawal symptom will occur. So for the dysphoria, it happens due to reduce in the dopamine activity, which is the neurotransmitter that involved in the pleasure and also reward. So when this dopamine reduce, they will also reduce in the feeling of pleasure and also reward. So that's the general irritability happen when the neurotransmitter imbalance and there is an increase in the stress hormone, which lead to the emotional instability. And the third one is the insomnia. So the insomnia happen due to decrease in the level of the norepinephrine, which cause the sleep disturbance. And the last one is the feeling drowsiness. So this happens due to the rebound hypersomnia and reduce in the neurotransmitter activity. As the result, there is a reduce in the arousal and also energy.
Today I'll be talking about treatment and antidote for amphetamine. There isn't a specific treatment or antidote for amphetamine, but instead we can provide with acute management or as well as long-term management. So in acute management, we can start with initial assessment where we assess patients' ABCs, airway, breathing and circulation, and also take a good history of the substance use, including its type, amount and also time of ingestion. Next, we can provide symptom management where we treat the symptoms such as lorazepam and diazepam for anxiety, beta blockers for hypertension, and benzodiazepine for seizures. Thirdly, we can provide decontaminations where we give patients activated charcoal because activated charcoal will limit the absorption of amphetamine. And remember, activated charcoal is only effective within the first hour of ingestion. At last, we can provide supportive care such as intravenous fluids to maintain hydration and electrolyte balance, as well as oxygen therapy for patients suffering from hypoxia and respiratory distress. In long-term management, it's finally time for our patients to detox. So they can either join a detoxification program or also join a rehabilitation center. So in rehab facilities, they provide counseling and motivation to patients in order to change their behavioral patterns. Next, they can also get medication-assisted treatment. There isn't a specific medication, but there are mostly medications that help with withdrawal symptoms such as antidepressants. And lastly, we highly recommend the patients to join a support group. So through the support group, they can get emotional support and such. So that's all from us. Thank you.